Thank you, beloved, for joining me again. This is Dr. Opoku-Asare. I am an interventional cardiologist and also a vascular specialist. We've been talking about why do legs swell, and this is going to be our third episode on it. I will encourage you to go and watch the others and help somebody. Why am I saying this? It is believed that vein pathology, which is one of the driving force here, is so predominant that every 2 in 1 woman has it, and probably every 1 in 3 men have it. But it is believed that across board, more than 50% of the people have a vein-related pathology. And today, we are going to lay emphasis on why do legs swell. In a previous episode, we gave certain we talked about prolonged sitting, prolonged standing. And we also talked about our last episode, other causes of swelling of the leg, which is a liver problem. When somebody's leg is swollen, it can be a liver problem. When somebody's leg is swollen, it can be a heart problem. It can be a sign that their heart is failing. When somebody's leg is swollen, it can also be evidence that their kidneys are also failing. So as we said the last time, it is important that if you have a swollen leg, it is very important that you check and make sure that your liver function is all right, your kidney function is all right, and your heart function is all right. These are things that should be quickly ruled out to make sure that there is no major thing that is going on, even over there. And today we want to lay emphasis on another area. Why do people's legs swell? We talked about it a little bit in the previous episode, but let me lay emphasis here. One of the reasons why people's legs swell, especially if one leg is bigger than the other significantly, is blood clots. Right? Blood clots is one of the reasons, and there may be predispositions. So what causes people to have a blood clots? One of the things that causes blood clots is a genetic predisposition. If somebody in your family had a blood clot, it's important to pay attention to it. Okay, the other things that can cause blood clots is immobilization. Immobilization in the form of, like, you went for long surgery, you were staying in one place, that can be one of the causes. Or you traveled and you had a long flight, or you had a long travel in one place, that can lead to a clot. It's not the process itself, but it is believed that there's a predisposition to that. Or somebody being admitted to a hospital, recent hospitalization, during which the person does not move much, that can also lead to a clot. So I had a patient that traveled to Europe, and before they went to Europe, I'm telling you this story because it's important for you to know. Before they traveled to Europe, the person realized that there was a little bit of swelling in their legs. And they went to Europe. And when they went to Europe, once they landed, the person became short of breath and collapsed, actually. And you know what had happened? What had happened was the fact that the clot has now moved from the leg into the lungs. And when the clot moves from the legs into the lungs, it kills rapidly. That's what we call pulmonary embolism. The word pulmonary here is referring to the lungs.
This episode is sponsored by Advanced Cardiovascular Institute. ACI treats a myriad of cardiovascular issues using patient-centered, minimally invasive procedures. Dial 301-755-6500 or scan the QR code to schedule your appointment today.
So, if one leg is bigger than the other, it is imperative that you get it checked as quickly as possible to rule out a clot. Why am I saying it as quickly as possible? Because unlike anything that we said over here, the one that kills and kills rapidly, it is the fact that the clot moves from your leg and it goes all the way into the lungs. The challenge with having a clot issue going on here is the fact that most of the clots in people are actually located in the iliacs. And even with our ultrasound, we are sometimes limited in be able to find our iliac clots. At least in my practice, we do a lot of iliac ultrasounds, and we have found a significant number of patients who had a compression of the iliacs, but more importantly, they had a clot in the iliacs, and that made a difference here. So when the legs are swollen, it is important not only to look for a clot only in the what? Only in the leg, but also sometimes to see whether if you have a good place, they can also do an ultrasound of the iliacs to see whether there is any evidence of iliac compression over there. Let me give you a story here. I had a very nice woman who had been my patient, and she went to a primary care doctor. And when she went to a primary care doctor, listen to this story.
This episode is sponsored by Zenith Christ Family Chapel. ZCFC is a scripture-based church located in Spencerville, Maryland. Join us every Sunday in person or live on YouTube at 2:30 p.m. Eastern Standard Time. God bless you.
Her both legs were swollen. In medicine, when both legs are swollen, based on everything that I've told you, it is very unlikely that it is due to a clot. Listen to this. So this woman was seen by the primary care physician who saw that both legs were swollen, and she was also short of breath. So when you have two legs swollen and you are also short of breath, the diagnosis that we doctors come to first of all is the fact that your heart is failing. In most people, when their heart is failing, both legs will swell, not one leg. And then we'll be talking a little bit about the heart failure part, so that is going to help you. So you can join us, because why do legs swell? In some of my discussions, I will come specifically to the heart failure component, and we can discuss that. So this patient came to me, and when she saw me, I felt that this was heart failure. But there was something about it that did not fit. So I told the patient that when you go to the hospital, make sure you call me before you leave. So the patient went to an ER of a hospital, and the first thing that they did was to find out whether she's got heart failure. And they realized that there was no evidence of heart failure. Her legs were swollen. So I got a call from the ER doctor that we did not find any evidence of heart failure. And I said, yes, there is no evidence of heart failure, but it doesn't mean that the woman should go home. The challenge we have with our healthcare system is the fact that if we don't find what we think we're looking for, then sometimes we interpret it as the fact that the patient has got no problem. No. If the patient has a problem, our goal is to be able to deal with this. So that is exactly what I told the ER doctor, that if the patient has no swelling, if the patient has a swelling in her leg, in both legs, and it's so much, something is going on. Go and look into the iliacs and see whether within the iliacs you have evidence of a clot over there, because clots may be hiding in the person's iliacs. So I told the ER doctor, and they said, okay, fine. It didn't take too long at all. After they did an ultrasound on the patient, they realized that her whole leg from top to bottom is full of clots. So it is important not to discard the idea that your leg is swollen. If your leg is swollen, it is important to rule out a clot as quickly as possible. And if there is no clot, then we can deal with the other causes of the swelling. They are not emergent. They are not something that if it's not done today, you are going to die. But if there is a clot and we do not address the clot and the clot goes to your lungs, that can be fatal. You know, may I share with you a story of a young guy that I know? He's a brother of a friend of mine. This is a young man who had his leg swollen. And one leg was swollen. And this young man has a very distinguished healthcare person in their family. Very distinguished person. Somebody that I know of. Now listen to me. Listen here. Listen. And this particular person, he had a swelling of the leg. No biggie. Right? He had it for some time. But they never checked whether he has a clot in his legs or not. I'm talking about something that happened not too long ago, in terms of years. I don't want to give too much specificity here, but this is a friend of ours. Listen. They never checked whether he had a clot. So, this young man, based on the advice of his family member, who had been telling him, please go and get it checked. Go and get it checked. Go and get it checked. The young man did not go. So one day he became short of breath. Listen to this. This person is less than 50 years. My understanding is that he may be even less than 40 years. Listen. This young man went to the emergency room of a hospital because he was short of breath. Let me tell you what happened. When he went to the emergency room, complaining of shortness of breath, whilst complaining of shortness of breath, he collapsed. He collapsed and they tried to resuscitate him. But he never made it. I can tell you this. When you get a heart attack, most of the time you will make it. But when you have a massive clot in your lungs, the probability of making it is very, very small. So this young man, he ended up dying at a relatively early age because he did not check for the clot. To be very honest with you, and sadly, this is one preventable death. It's not that we will not die if Jesus does not come now. Our prayer is that may God give all of us long life. And I prophesy long life on you. But God grants us wisdom to make sure that we take measures that will help you to avoid this situation. So what do you and I will need to do? It is very important that you don't sit down for too long. If you are traveling in a plane, and especially you know that your legs get swollen, because venous insufficiency can also cause clots, right? I will strongly recommend to you that when you sit for an hour or two, it is important that you get up and walk. If you are traveling from here to California, you travel and walk. Remember the story of the patient that I said went to what? To Europe. The flight from here to Europe was about 6 to 7 hour flight, and she collapsed at the airport. This person had to be in European hospitals and pay a whole lot of money because of something that if when the legs were swollen, You could have checked. This person that I'm talking about has actually got venous insufficiency. That means that the veins in that person's legs were leaking. Thank God that she is alive. And because she is alive, we all get a privilege to enjoy the gift of God and the gift of life that God has given to her. My prayer to you is the fact that we and I will have this conversation 40 years from now, because of the goodness of God and your obedience to what I'm talking about. So if you know somebody, I always tell people, when you go to the airport and people are coming out of the plane, it's shocking how many of them have swollen legs. And yet they don't do anything about it. If you have a family member, the reason why we do this program is to be able to help you, to help somebody. If you know somebody whose leg is swollen, talk to them, ask them, have you ruled out a clot? Make sure that is taken out of the picture, so that they do not have any regrets over there. So let us look at the things that we talked about. Immobilization is a critical element. So immobilization can be a long flight, a long trip, wherever you are going, sitting down. It can be hospitalization. It can be long surgery. All these ones, especially if the surgery is done without anticoagulation, it can lead to a clot. I had a patient that went for a knee surgery and he came back. And I was talking to him and I realized that he could not complete his sentences very well. So I told him to walk around my office. So after walking around a little bit, I realized he was very short of breath. It wasn't surprising to me that, because he had a lot of venom, he had all these varicose veins in his leg. So I told him before the surgery that make sure you wear the compressive stockings and other things. So I did an echocardiogram on him and I realized that the right side of the heart was struggling. I quickly sent him to the hospital and he had a clot in his lungs. He could have lost his life had the Lord not granted us the grace and the wisdom to be able to make that diagnosis. So when you go for surgery, and that is why it is important that if you go for knee surgery, if you go for hip surgery is a huge one, and they give you the anti-clot medicine, it is important that you take them. Now, we used to give it a short time. Now they give an extended form of anticoagulation to be able to help you. Listen to me. What I'm doing here, while I'm talking to you, I do not get $1, 1 cent from it. But I believe this is part of our responsibility, first of all, as citizens of this country, but more importantly, as children of God, that through the knowledge and the wisdom that God gives to me, I should be able to offer you an advice that is free, yet it is life-saving, not only for you, but for your family members. So, as much as you can, you have to deal with what? Immobilization. So that is the first thing. And especially if you have a family history of somebody having a clot, it's very, very important that you pay attention to these principles of keeping yourself moving and avoiding staying on for a long time. And then checking the leg for clots. Any vascular practice can do this for you. Right? Any good radiology center can rule out this one for you. And if there is no clot, then we can look at other factors. If the leg is swollen and there is no clot, there are other reasons for it, and we can always look at it, and that will be able to help you, right? So that is it. And then the third point that we talked about is there are certain medicines and other things that may be related to a little bit of clot. We know that in the past, contraceptives, especially for young women, was associated with a little bit of clot. So if you are on medication that can potentially cause a clot, it is important that you are also on the lookout to make sure that no clot and is found. One of the biggest thing that is associated with clots, I want to talk about that, especially clots that can sometimes be deadly, is cancer. So if you are a cancer patient, whether you're a cancer survivor or not, or you're undergoing cancer treatment, it is also very important to pay attention to clots and its formation, especially clots in the legs. And to have a clot on top of a cancer can really complicate the issues that we are dealing with. So when God gives us this wisdom, it is important for us to use the wisdom to lead our lives. Interestingly, whenever we find cancer in somebody without any cause, whenever we find, a clot in somebody without any cause, doctors sometimes can look for whether there is a hidden cancer that we do not know. Because of the close relationship between cancer and blood clots, both of them, we trust the Lord and in the name of Jesus that they will not prevail in our lives and in the life of anybody that is hearing me. So today, in a nutshell, we talked about one very important aspect about why do people's legs swell. Today, I talked about the common thing that people fear, but it's not a common cause. Blood clot is not the commonest cause, but it is the most feared of them all. So it is imperative that you rule it out, but more importantly, do the things that will prevent you from getting them and saving your life. So we want you to send this video to somebody, to another person that you know that their legs are swollen. Tell them to join us in our campaign that through the knowledge and the wisdom of God, everything in us will be used to save lives and make things better. God bless you, and I'll come back to you next week with further episodes about why do legs swell. Thank you very much.
Thanks for listening to God's Rhythm. Tune in every Monday and Thursday at 10 a.m. Eastern Standard Time to learn how to protect your heart. God bless you.